we have what we call cervical erosion, and we said cervical erosion is when the outside of the cervix is now inside, and the inside of the cervix is now outside. Basically, that's what cervical erosion is all about. And I'm saying we have three types of cervical erosion. We have congenital, we have true erosion, and we have pseudo erosion. What then is congenital erosion? In congenital erosion, there is an ectopic cylindrical epithelium of the cervical canal present. Ectopic means something that is not supposed to be there. Okay, that's what it's called, ectopic. Just like we're saying ectopic pregnancy. That means the pregnancy is not supposed to be there at that place, but we are finding it there. The same way, the cylindrical epithelium is not supposed to be there, but we are having it there. So as a result, we call it what? Congenital erosion. Then we have true erosion. The true erosion, it is characterized by, first of all, it is a pathological process. Pathological process characterized by the damage and desquamation of the flat epithelium of the vaginal part of the cervix. Again, there is a damage and desquamation of the flat epithelium of the vaginal part of the cervix. And I'm saying that true erosion exists no more than 2 weeks. No more than 2 weeks. And it passes into the next stage, which is pseudo erosion. So from true erosion, it moves to what? Pseudo erosion. It moves to what? Pseudo erosion. Now let's look at our question. The question is, a gynecological examination of the uterine cervix of a 30-year-old woman revealed some bright red lustrous spots that easily bleed when touched. Biopsy showed that a part of the cervix was covered with cylindrical epithelium. And we know that we're not supposed to have cylindrical epithelium at these places, but we are having it with papillary outgrowth. Papillary outgrowth. And we are seeing that in the depth of the tissue, the growth of glands was present. What pathology of the uterine cervix was revealed? What pathology of the uterine cervix was revealed? So first of all, it is clear to say this should be what? Congenital. This should have been what? Congenital form of what? Congenital form of what? Erosion. But unfortunately, there's nothing like congenital erosion in our option. Okay, and this is not a true erosion either. It is not a true erosion either. So our best bet should be pseudo erosion. Pseudo erosion. I hope I've got your question tackled.
Yes, sir.
Awesome. Awesome. That is the whole idea. That is the whole idea. Great. Dr. Sarah, have you spoken?
No, but you've not explained the pseudo erosion the way you did for true erosion.
That's what I'm saying, that when we say pseudo, it's like a false erosion. False erosion. So we don't really have how do you call it? Specific definition for it or something like that, but it's like a false erosion that is coming out. That's why I said we can't describe this as a true erosion. Because with a true erosion, definitely the inside must come out and the outside must go inside. But over here, we are having, actually, the actual answer is supposed to be congenital. Congenital. But there's no congenital. So we use what? A pseudo erosion, meaning it is a false erosion or something that wants to mimic a true erosion. Something that wants to mimic a true erosion. But of course, I'll check and see if there's a specific definition for it. But for now, I don't know if there's a specific definition for it. But it says false erosion. False erosion. But I don't know if you are still lost.
Maybe can I contribute to that a little, sir?
Please, feel free, doctor.
Yeah, according to, because I've come across this question
Okay.
sometimes back,
Okay.
and I was explained to by one of our teachers anyway.
Okay.
So
Okay.
she let us realize that the pseudo eruptions only take place in the cervix as well. So
Awesome.
she always said anywhere that it is aligned that maybe there is uterine cervix, it only occurs in pseudo erosion occurs in that uterine cervix. That's actually going to be pseudo erosion because they mentioned the uterine cervix there.
Awesome.
So, and while she was trying to show us then the main definition of pseudo erosion as well, the place where we were reading it from that time mentioned something like cervix, uterine cervix as well.
Mm, great.
Oh, is there any other erosion that occurs in uterine cervix?
Well, this is what we have. So I don't know. Yeah.
Please, the tree erosion, he said it is an acquired.
I'm saying it's an acquired pathological process. Acquired pathological process. Can you hear me? Someone was talking.
So please, the tree erosion, he said it's an acquired pathological
Pathological
process
process characterized
characterized by
by
the what?
a damage. There is a damage and desquamation of the flat epithelium of the vaginal part of the cervix. There's a damage there. Damage to the flat epithelium. You know, the vaginal area has what? A flat epithelium. So these places are damaged. And when they are damaged, it can sometimes enter inside and the inside will come outside. So something like that. That's a true uh, erosion.
I want to ask what's the difference between influenza and para-influenza?
Difference between what?
Influenza and para-influenza, like if we see question
I
on that.
can't hear you.
Influenza, you were can you hear me?
I can hear you now.
Yeah, I said if I want to distinguish between influenza and para-influenza, how will I? Because you told us influenza is about this acute respiration.
Yes.
What about
Actually,
for para-influenza?
yes. Actually, they are all upper respiratory infection. So influenza or para influenza, they are all the same. Just that it is a species that is different, but they are all. It's just like having typhoid fever. You know, typhoid we have Salmonella typhi and Salmonella paratyphi. There's something like that. Salmonella typhi, Salmonella paratyphi. It happens. However, the common one is the influenza. The most common one is what? Influenza. Just like when we talk about respiratory infection, we know of COVID. We know of COVID, but we didn't know that a time will come then to become so popular like this. Do you understand me? So that's how it is. But they're already there. But when you talk about the infection, then you're basically thinking about what? Influenza more than the para influenza. So basically, they are all clinically they are all the same. Just that when you're looking at the microscopy or whatever it is, there could be some sort of slight differences. But clinically, they are all the same. And treatment is the same. Everything is the same. And they can all cause the complications in the lungs and even in the heart as well.